As we know, there are many wonderful causes here in the month of May, and one of them being Stroke Awareness Month as the month of May here. And as we know, seconds truly count, certainly minutes do too. And so if you are feeling like you're experiencing some symptoms of a stroke, or maybe you see your loved ones or someone that you work with, we know that minutes are really important here, and something really exciting about this stroke mobile, you could say. I'm joined today with two incredible doctors at the Cleveland Clinic, Dr. Mark Gilnoff and Dr. Hussein. Thank you both for being with us today.
Thank you.
This is one of the only ones in the world, this incredible stroke treatment mobile that you can dispatch if you feel you're getting that call that someone's having a stroke, and they can be treated right here at their premises instead of wasting the time of getting them to a hospital.
Correct, that's absolutely right. This is essentially an emergency room on wheels. We've partnered with the City of Cleveland, and this ambulance, if someone has symptoms of a stroke and calls 911, this ambulance will be co-dispatched with a Cleveland ambulance. We'll arrive on the scene, and if the Cleveland paramedic team feels that we're appropriate, they'll hand over the care to us. Then we can go onto the vehicle and start initiating the workup and the treatment for stroke.
Just incredible. Dr. Mark, this is something that's truly saving lives.
Oh, this is amazing. And this is not your average ambulance. I mean, wait till you see what is inside of this.
Well, let's take a look. Okay, so now you get the call that someone may be having a stroke, so you dispatch this unit. And then we've got our team in here. Hello, gentlemen.
Hello.
Thank you guys for being here with us today. So what happens? You actually have a CAT scan in here.
Correct, so you can see the CAT scanner at the head of the ambulance there. So when a patient is handed over to the team here, they'll get our patient onto the vehicle. They'll quickly assess the patient for vital signs, take their blood pressure, get them on monitors, take some blood tests, which can be run on this side of the ambulance here, and then we can actually perform a CAT scan on the vehicle, so we don't have to actually have the patient come to the hospital. We can do this right here in the truck.
So from the moment somebody comes inside till you see the CAT scan image, how long is that?
Typically, on average, it takes us about 5 minutes to get that CT scan and get it transmitted over to our main campus, where our neurologist and radiologist can look at the images and decide about treatment.
Incredible. And what I was shocked about, too, we saw the CAT scan. We showed you that a minute ago. And here you mentioned, Dr. Hussein, about the blood tests, and that can be done right here. So then you know if you do need to administer that clot-busting drug, that they're okay to be able to take it.
Correct. That's from a safety perspective very important to have those blood tests. And then in the center here we see a monitor with my colleague Dr. Wisco, who's on the monitor there.
Hello, doctor.
This allows us to, the physician from the main campus, to actually beam into the vehicle, talk to the patient, examine them, talk with the crew to make sure that everything's okay to go ahead and start treatment right here at the spot.
And I know one of my family members, my mother, had a stroke 17 years ago and was administered that clot-busting drug. It truly saved her life. Mm-hmm. Dr. Mark, talk about some of the symptoms. So these are those key words that you guys would be hearing on that 911 call. What are those symptoms that you're seeing that are of stroke?
Well, the first thing to know is the symptoms are usually sudden. Someone goes from I'm fine to I'm not. And if you see somebody and they have a change in their face, it looks asymmetric, what we call a facial droop. If you hear somebody say, one side of my body isn't as strong or feels numb, then that's a problem. And also speech can become garbled. I think the issue is a lot of people have some symptoms and they think it'll probably go away. Mm-hmm. What's worse, to leave a stroke untreated or to call and it turns out it wasn't a stroke and you're maybe a little embarrassed? Don't be embarrassed.
Absolutely.
Much worse to do
nothing. And we're afraid. That's a big word to say that you're maybe having a stroke. I know with my mom it was a sensation in her hand, in her left hand, and she felt, because she was at her student's recital, that she was clapping too loudly the day before. So that's what she was blaming it on those first few hours until knowing the left side. Is it usually the left side?
It could be either side, right, or the left side, but usually it's on one side of the body. So one side versus the others, it will be having some kind of weakness or problem. The nice acronym for people to remember is the FAST acronym. Mm-hmm. So F stands for face, if you have any kind of droopiness in the face. A stands for arm, which could also apply to the leg if there's any kind of weakness or difficulty with the arm or leg. S stands for speech, if you're having difficulty with your speaking. And then T, again, T comes for time, because time is so important in this situation. It's estimated we lose somewhere around 2 million brain cells a minute in the situation of a stroke, so it's probably one of the most time-sensitive conditions. Really important to call 911 right away and get yourself medical attention.
So be fast. fast. And gentlemen, we want to thank you guys for being here with us today. These would be the guys on the team that would greet you and get you right in here and with the best medical care. And we see Cleveland Clinic leading the way again. Dr. Mark Gilanov, Dr. Hussein, thank you both. And doctor, thank you on our monitor over here. We appreciate it. And just incredible. Another way that they're saving lives at the clinic. Thank you both. But don't forget the symptoms. Be fast. Very important stuff to know. All right, we are going to take a short break. There is much more coming your way here on Fox 8 News in the Morning. A very busy news day. We'll be right back.